Hi, my name is BrittanyGriggs, and I'm going to be doing an informative speech on autism. Autism is defined as a mental condition characterized by impaired social interactions, speech and language difficulties, and repetitive and stereotypical behaviors. Impaired social interaction is the hallmark feature and is present in almost all forms of autism. I define autism as always unique, totally interesting, sometimes mysterious disorder. To have a better understanding of autism, one must have an open mind, be patient, and willing to learn. Open mind. First, you need to have some knowledge of the characteristics. Like most disorders, autism varies from mild to severe. Somewhat in the middle, there's a mixture of high and low functioning characteristics, such as flapping the arms, very little speech, and poor or great eye contact, and very hard time understanding concepts. Childhood autism rating scale can be done to find out if the child has mild, moderate, or severe autism. This scale rates the functioning in 15 categories. Higher the scores reflect higher severity of autism. Those on the moderate to severe end of the spectrum generally have no to little speech and often overlay of some cognitive impairment. Those with mild autism have strong verbal skills and few behavioral issues. However, they may have significant problems with social communication. They may also have problems coping with too much sensory input, loud noises, and bright lights. Social difficulties include seem to be aloof, have a little or no interest in other people, not understanding other people's emotions, and prefer to be alone. Sometimes a child may lose social skills if they once had, such as waving goodbye. This is found in about 1 out of 4 cases. Problems with communication. When speech develops, the language may not develop well. Autistic children may not be able to express themselves well, not able to understand gestures, facial expressions, or a tone of voice, saying odd things, using odd phrases, sometimes making up their own words. Pretend play usually is limited. They tend to do the same games and activities over and over again. Unusual behaviors include odd mannerisms such as odd pointless movements, anger or aggression if routines are changed. Autistic children tend to hurt themselves when they are angry by banging their head or hitting their face. Sometimes they do this to get attention. Actions may be repeated over and over again, like rocking backwards and forwards. And older children and adults may develop obsessions such as timetables and repeating them over and over again. Parents often find these problems very confusing and may become frustrated. Because autism runs on a spectrum, it's important to keep an open mind. This is extremely important when trying to teach a new concept to an autistic child. One must be able to think of ways to explain things in a way that they can understand without getting angry. Patience. Stress is something parents in general are all too familiar with. There is the physical stress from carpooling, preparing meals, bathing, homework, and so on. This is compounded by such psychological stressors as parent-child conflicts, not having enough time to complete responsibilities, and concern regarding a child's well-being. When a family has a child diagnosed with autism, stressors are added. Research indicates that parents of children with autism experience greater stress than parents of children with mental retardation and Down syndrome. Because children with autism may not be able to express their basic wants or needs, parents are left playing a guessing game. Is the child crying because they are thirsty, hungry, or sick? When the parent cannot determine their child's needs, both are left feeling frustrated. The child's frustration can lead to aggressive or self-injurious behaviors that threaten their safety and safety of other family members. They tend to throw tantrums or shut down completely. Although autism can be exhausting mentally, physically, and emotionally because of the many layers and complexity of the condition, it is important that parents find ways to connect with their children in a meaningful way. In order to find more ways to connect, parents can educate themselves about autism to gain knowledge and understanding, modify their approach, give their child plenty of praise and positivity, accept their child as he or she is, and be patient and loving. The social world can be a frightening and chaotic place for your child with autism. Your child needs order, structure, and predictability to feel safe and secure. To help him adjust, approaches can be modified by giving your child clear instructions and communicating in a direct, concrete way. Inform your child of any potential changes to come, as disruptions in routine can be very upsetting. Get to his level because he cannot get to yours. Building a bridge and try to close the gap. It takes a lot of patience to connect to his world, but it can be done. Show encouragement and support for all the good things your child does, as it helps to build self-esteem and create a more positive environment. Although it can be very hard to stay calm and not lose patience when dealing with behaviors such as tantrums, always try to focus on the good, as a child reacts well to positivity. Be patient and view any setbacks as part of the learning and growing process. Unconditional love and patience can replace frustration. Parents should come to the realization that the child needs to be loved and accepted on his or her own terms because he can't adjust so well in many environments. Your child is still an individual, first with his own personality and unique way of being. With love, patience, and kindness and acceptance, parents come to see the beautiful soul that is there within the child despite any limitations of his mind. By having belief in your child and working to build bridges, you will help to bring out the best in him. Patients and autism need to have a relationship. With my autistic nephew, teaching most anything to him can be very frustrating for him and you both because he has a hard time focusing and staying focused. You must have patience with being repetitive. With autism, you're forced to live with a lot of repetitive behavior, and you find yourself being as repetitive in getting your point through to your autistic child. It's wearing, and you'll have your patience tested over and over. Autistic children pick up on your stress signals quickly, and what triggered your impatience to begin with will only escalate. Autistic children are told between 250 to 500 times more often than typical developing children what they need to do in certain instances before it really sinks in for them. Autism is different in every child, so what works for one might not be effective for another, and autistic children don't necessarily have the same symptoms or the same severity of symptoms. Avoid touching and hugging someone with autism, as they typically do not like to be touched or manipulated by others, though they may want to touch or hug someone themselves. Provide loose-fitting clothes, since the sensation of tight-fitting clothes can aggravate them. Always be consistent, as this helps them know what to expect. Patience, 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 and see autism as a different ability rather than a disability. Willing to learn. Autism appears to have its roots in early brain development. However, the most obvious signs of autism and its symptoms tend to emerge between 2 to 3 years of age. Statistics from the U.S. Centers of Disease Control and Prevention identify 1 in 68 American children have autism, and that autism is 4 to 5 times more common among boys than girls. Estimated 1 out of 42 boys and 1 out of 189 girls are diagnosed in the United States every year. In sets of twins, one twin has a greater risk of having autism. Also, sibling boys are at a greater risk. What causes autism? Until recently, the answer would have been, we have no idea. Research is delivering the answers. Most cases of autism appear to be caused by autism risk genes and environmental factors that influence early brain development. Risk factors involve events before and during birth. They include advanced parental age at the time of conception, maternal illness during pregnancy, and birth difficulties, more often those involving periods of oxygen deprivation to the baby's brain. Reducing the risk. Prenatal vitamins and a diet high in folic acid before and after conception. Speech and language therapists, occupational therapists, and educational psychologists can help improve your child's ability. However, there is no cure for autism. The specialist education and support aim and maximize the potential of each child as they grow into adults. Autism is considered the fastest growing developmental disability. More children will be diagnosed this year with autism than with cancer, diabetes, and AIDS combined. More and more people in our community are being touched by someone, a family member, a friend, a neighbor, who has a connection to the autism spectrum disorder. I encourage everyone to remain open-minded and willing to learn about this perplexing disease. Today we have taken a look at the disorder called autism. Though there are many downsides to autism, let's take a look at the genius that hides behind autism. Intelligence and autism. Some people seem to view autism as a form of genius. People that believe this think that we shouldn't try to fix or change autistic people, partially because we wouldn't want to deprive the world of their genius or genius in general. Being autistic doesn't make you below average intelligence, neither does it make you a genius. Intelligence is a reliable marker for how well an autistic person will fare in life. People that are not afflicted may also have high intelligence, create inventions, and make the world a better place to live. Dr. Casanova of the United States of Louisville in Kentucky has spent many years studying the differences in autistic brains and normal brains. The main difference is in the structure of the nerve cells that form the cerebral cortex. The pattern of connection might reduce a person's ability to generalize and increase his ability to concentrate. Each individual with autism is unique. Many have exceptional abilities in visual skills, music, and academic skills. About 40% have average to above average intellectual abilities. Many on the autistic spectrum take deserved pride in their distinctive abilities and atypical ways of viewing the world. About 25% are nonverbal but can learn to communicate using other means. Others with autism have a significant disability and are unable to live independently.